Okay, so welcome to Pharma Growth Hub, and I am super excited to share with you some important information about the basic terms in case of stability study, right? So there are few terms which are very important, and we must understand those terms on very ground level. So let us begin. And as a part of this today's video, right, we will be discussing about total number of 26 basic terms. So let us begin with the term number 1, the basic term number 1, which is stability study. So what is meant by a stability study? And here is the answer for this. Okay, so the stability study is defined as continued conformance of drug substance or drug product to its specification with respect to physical, chemical, or biological integrity throughout storage period and use under the influence of temperature, light, and humidity. Right? So that's the reason we conduct a stability study in case of at various temperature conditions, at various humidity conditions, and also at the photo stability requirement. So these three parameters covers the entire need of stability study. So the basic term number 2 is what is meant by ANDA, right? And an abbreviated new drug application, which is the ANDA, is described as an application that contains information to show that the proposed product is identical in active ingredient, dosage form, strength, route of administration, labeling, quantity, performance characteristics, and intended use to a previously approved reference drug product, that is called as a RLD. So abbreviated new drug application, which is ANDA, is a generic drugs application, right? And as you know that the stability study is the one of the important document required for the ANDA submission. The basic term number 3 is the drug product, and what is meant by drug product, and here is the definition. The dosage form in the final pack intended for marketing, right? So any dosage form which is packed with the intention of selling is called as a drug product. The 4th term is accelerated testing, right? And what is the definition of accelerated testing? So the studies designed to increase the rate of chemical or physical change of a drug product by using exaggerated storage conditions as part of formal stability study, right? So what is called as a accelerated testing? The exaggerated storage condition. So if you conduct a study at 40 degrees Celsius and 75% RH, then you can say that I am actually conducting a accelerated testing for my drug substance or drug product. The next term is the intermediate testing. And what is meant by intermediate testing? The study usually conducted at 30 degrees Celsius and 65% RH and designed to moderately increase the rate of chemical or physical changes for a drug substance or a drug product intended to store at 25 degrees Celsius is called as a intermediate testing, right? So intermediate testing is not exaggerated storage conditions, but not also a mild storage condition. So it is called as a moderate storage conditions, wherein the rate of chemical or physical reaction can be increased to the moderate level, right? And what is the desired temperature and humidity in case of intermediate testing? It is 30 degrees Celsius and 65% RH, okay? And it is very specific to when you intend to store the drug substance or drug product at 25 degrees Celsius. The next is the long-term testing, okay? And let us understand what is the definition of long-term testing. So the stability study under the recommended storage conditions for the retest period in case of drug substance or shelf life in case of drug product, right? So the stability study which is conducted at the recommended storage condition is called as a long-term stability study. So for example, if your recommended storage condition is 25 degrees Celsius, and in case if you conduct a stability study at 25 degrees Celsius till the end of the shelf life or till the end of proposed retest period, then you can say that I am conducting a long-term stability study. The next point, stability study in inverted position. Okay, and here we go. The stability study in inverted position shall be conducted for aqueous based drug products stored in semi-permeable containers, right? So generally the stability study in upright position is studied, but in case if you are conducting a stability study for aqueous based drug products like injectables, ointments, creams, right, solutions, then you must also conduct a stability study by putting your container in inverted position. Okay, so the next point is photostability study. And how to conduct the photostability study? The product should be exposed to light with an overall illumination of not less than 1.2 million lux hours and an integrated near UV energy of not less than 200 watt hours per meter square. And generally the photostability chambers are used to conduct a photostability study. The next important point when it comes to photostability study is this study is carried out on one submission batch. So this is not required to be studied for all 3 submission batches, but it can be only studied for one submission batch. The next point is thermal cycling study, and there are 5 different points. The thermal cycling study is applicable for sterile products, applicable for products susceptible for phase separation, loss of viscosity, precipitation and aggregation, right? The product shall be cycled through temperature conditions that simulate the changes likely to be encountered once the product is in distribution, right? So what is meant by the cycling, thermal cycling study? You must study a product's stability not at the constant temperature but by varying the temperatures, and that must mimic the distribution scenario, and we will see what are the various conditions. The next point is the study is carried out on one submission batch. As like photostability study, you need not to conduct the thermal cycling study for all 3 submission batches but with only one batch. Now let us understand what are the testing conditions, right? Now there could be 3 scenarios. In case if you intend to store the product at 25 degrees Celsius, how to conduct now thermal cycling study? And here is the guidance. Minus 20 degrees Celsius for 2 days. So you need to store the drug product at minus 20 degrees Celsius for 2 days, and then followed by the same batch of drug product must be stored at 40 degrees Celsius and 75% RH for 2 more days. So this is the entire need of testing condition in case of thermal cycling study, and this is very specific when you intend to store the drug product at 25 degrees Celsius. Now the second storage condition, if you intend to store the drug product at refrigerated condition, that is 2 to 8 degrees Celsius, then what are the testing conditions? So minus 20 degrees Celsius for 2 days, right? So you need to store the drug product one batch at minus 20 degrees Celsius for 2 days, and then followed by the same batch must be stored at 25 degrees Celsius and 60% RH for 2 more days. So this is the entire testing requirement in case of you intend to store the drug product at 2 to 8 degrees Celsius. The next point is if you intend to store the drug product at freezer condition, that is minus 20 degrees Celsius or to minus 10 degrees Celsius, and here is the requirement. Minus 20 degrees Celsius for 2 days. So store the drug product at minus 20 degrees Celsius for 2 days, and then followed by 5 degrees Celsius for 2 more days. So this is the entire requirement of thermal cycling study. The next point is water loss study, right? And what is the definition of water loss study? So the water loss study is carried out to demonstrate that the aqueous-based drug products stored in semi-permeable containers can withstand low relative humidity, that is ophthalmic drug products packed in LDP container, right? So you must understand that for the water-based drug products, right, which are packed in what? Semi-permeable membrane. The semi-permeable membranes are those product containers or the packaging materials through which the water loss can happen. And in case the water content is very important for your drug product, for example, in case of ophthalmic product, where the content of water is very important as per as the characteristics, the performance of drug product is concerned. If there is a water loss happening because of the storage of drug product, the osmolality of drug product may get changed, and that can diversely impact on the drug product's performance. And hence we must also study a water loss in case of your drug product is aqueous based formulation and packed into a semi-permeable membrane like LDP container. So the next point is the temperature excursion study, right? And here we go. If during transportation the temperature varies extremely beyond the storage condition, the investigation shall be carried out for studying the impact on quality of the product. Now this particular term is not a general term conducted during the stability study, but in case of transportation of your drug product from one location to another location, or for a need of distribution, or if you are manufacturing at one site and final packing is happening at the another site, and you observe that this particular batch has undergone a tremendous change in the temperature, or if the temperature during the transportation of the drug product is beyond the excursion allowed temperature, then you must study the temperature excursion study, and here are the guidance. Okay, if you intend to store the drug product at, let us say, 20 degrees Celsius to 25 degrees Celsius, then what is the test condition? Minus 20 degrees Celsius for 2 days, followed by 60 degrees Celsius and 75% RH for 2 more days. So this is the way you can conclude on the impact of temperature excursion on your product for very specific batch. Now impermeable container, right? The containers that provide a permanent barrier to the passage of gases or solvent. Example, sealed aluminum tubes for semi-solid or sealed glass ampoules for the solutions, right? So all aluminum tubes or all glass ampoules, they are example of impermeable container. So these containers doesn't allow the passage of either gas or solvent like water, and hence they are called as impermeable container. The next point is the semi-permeable container. And what is the semi-permeable containers? The containers that allow passage of solvents, usually water, while preventing solute loss. So solute will not pass through the barrier from the semi-permeable container's wall, but they allow, the container allow a passage of solvent like water, right? And what is the example of semi-permeable container? LDPE, that is low density polyethylene, is an example of semi-permeable container. The next point is what is meant by the pilot scale batch, and here is the definition. A batch of a drug product manufactured by a procedure fully representative and simulating that to be applied to a full production scale batch. For a solid oral dosage form, a pilot scale is generally at a minimum 1/10 that of a full production scale, or 1 lakh tablets or capsules, whichever is larger or greater. So this is the definition of pilot scale batch. For example, if your manufacturing size is the batch size at the manufacturing site is, let us say, the 5 lakhs, right? 5 lakh tablets, for example. So in that case, the 10% will become 50,000. And here is the requirement, the 10% or the 1 lakh. Now in this case, the 10% is lower than the 1 lakh, and hence you must have a pilot scale batch size of 1 lakh tablets or capsules. Or in another example, let us say that the manufacturing batch size is, let us say, 20 lakhs, and hence the 10% will become now 2 lakhs, and you have to choose between 2 lakhs and 1 lakh, whichever is a greater. So obviously 2 lakhs is greater than 1 lakh, and hence the pilot scale for this particular product with 20 lakhs batch size will be a 2 lakhs of the number of dosage forms. The next term is the primary batch, and here is the definition. A batch of a drug product used in a formal stability study from which stability data are submitted in a registration application for the purpose of establishing a shelf life. So in case of ANDA, as we know that we need to submit 3 primary batches, and hence those 3 primary batches from which the stability data or from which the shelf life is established, so those batches are called as a primary batches. The next point is the production batch. A batch of a drug product manufactured at production scale by using production equipment in a production facility. So as simple as it is. The next point is a typical batch. And what is the definition? The batch which shows out of trend results, right? So it can be during a stability study, that certain batch during a given stability study time point, if the results are not within the trend as compared to its own performance or with compared to the another batch, then you can say that this particular batch has shown a typical result, and that batch is called as a atypical batch. Okay. The next point is the primary immediate pack, and what is the definition? A constituent of the packing that is in direct contact with the drug product, such as PVC foil, and the PVC foil is called as what then? The primary immediate pack, right? The next point is marketing pack, and what is the definition of marketing pack? The marketing pack is the combination of immediate pack and the secondary packaging, and here is the set of the marketing pack. The blister, which is immediate packing or the primary material, plus the carton plus the shipper. So this kind of set we can call it as a marketing pack. The next important point is expiry date. The date placed on the container label of a drug product designating the time period, designating the time prior to which a batch is expected to remain within approved shelf life specification if stored under defined conditions. So very simple. The next is what? Extrapolation, and here is the definition of extrapolation. Extrapolation is the process of estimating the value beyond the original observation range. Now the extrapolation is widely used during the submission of ANDA application. So as you know that the applicant generally will not have the entire stability data till the shelf life, till the proposed shelf life of any product, and at maximum cases the applicant will have a 12-month of long-term data. So based on the 12-month of long-term data and 6-month of accelerated data, the applicant can extrapolate and say that with these certain observations, my product will have a required specification till the 24-month, and hence my product's proposed shelf life can be a 24-month, and this entire exercise is called as what? The extrapolation. Okay. So the next point is the stability indicating method, and here is the definition. Method that can detect changes with time in chemical, physical or microbiological properties of the drug substance or drug product, right? So if your analytical method, it can be assay, dissolution or related substances, if your method is able to detect and identify the kind of changes that are going to happen throughout the stability period of your drug substance or product, then you can say that my method is what? Stability indicating in nature or stability indicating method. The next point is stress testing, right? And here is the definition. Studies conducted to determine intrinsic stability of the molecule by establishing degradation pathways in order to identify degradation products, right? So you can identify the kind of degradation that is possible when the drug substance or drug product is undergoing certain stage of stress conditions, like acid conditions, that is acid stress study, alkali stress study, thermal stress study, or you can also conduct the light stress study, then the humidity stress study, the water hydrolysis stress study, the oxidation stress study. So these are the few of the examples by which you can evaluate the various conditions under which you will have a different degradation pathways in case of your drug substance or drug product. The next point is the climatic zones, right? And what is the definition? The storage condition of the stability study shall be selected based on the climatic conditions of the country where product is marketed. And let us understand what are the various zones that is globally accepted. The zone 1 is temperate zone, and if you intend to market your drug product or substance at the country with a geographical condition of temperate, then you must conduct the long-term stability study at 21 degrees Celsius and 45% RH. If you are going to market the drug substance or product in zone 2 condition, zone 2 geographical countries, which is a subtropical and Mediterranean zone, then you must conduct the long-term stability at 25 degrees Celsius and 60% RH. Similarly, for zone 3, which is hot and dry, your long-term condition must be 30 degrees Celsius and 35% RH. Now, zone 4A is hot and humid, and the condition is what? 30 degrees Celsius and 65% RH. And zone 4B, which is hot and very humid, the requirement is what? 30 degrees Celsius and 75% RH. Okay, so the next point is in-use stability. And what is the definition of in-use stability? So in-use stability is the capacity of the drug product to comply with the specification after it is opened. Now, in many cases, you open the drug product, for example, the ophthalmic or the eye drop. So the eye drop can be used, let us say, for over a period of 1 month once you open the bottle of eye drop. So this indicates that the in-use stability of the eye drop is what? 1 month. Going one step ahead, you can say that if I open the eye drop for first use, and if I use the same eye drop bottle, right, throughout the period of 1 month, my eye drop will meet the requirement of stability specification. So that is the essence of in-use stability. The next important point is the field alert report, and here is the definition. The report submitted to the FDA in case of any significant problem observed in an approved drug product marketed in USA. Right? So you have submitted the ANDA to the US FDA, your drug product got an approval, and subsequent to that you have started the manufacturing and you have submitted few of the batches to the US FDA, right? But during the manufacturing, one of the batch, let us say, is not meeting the dissolution specification, and you have raised OOS for investigation. And hence, as this product is already into the US market, you must file a field alert report and you must intimate to US FDA. So this is the entire process of field alert report. So this is all about the few of the very important terms when it comes to the stability study. I hope you must have understand the content over here, but in case of any queries, please type your question into comment box and I will be happy to answer your question. So thank you very much guys for watching these videos, and bye bye.